Assalamu alaikum wa rahmatullahi wa barakatuh. A very good evening and welcome to another edition of Health Matters. After not spoken enough topic, a silent issue, but yet many are challenged with it. And that is infertility. Welcome to our fertility show. There was also a fertility expo that happened earlier this year or late last year, and the first of South Africa that was presented. Was very excited to be part of it, and just after that the pandemic hit us. But alhamdulillah, we are still needing to remind ourselves that the possible and the second wave, is upon us, and we need to respect and absolutely adhere to the social distancing rules, sanitize, wear mask. And I know for some people it is very hard, and we have to admittedly say that it's very hard to wear that mask. But there are visors, there are different ways of wearing your mask. With that visor, protect yourself or just stay at home. As I said, we're dealing with fertility. Please do interact with us on our WhatsApp line, on our social pages. Catch us on our various social pages as well, Facebook, YouTube, and streaming live on itv.tv. Click on live stream. I'm Khawa Solomon. I'll be with you for the next hour. Do interact with us. You make the show. So first, let's just get an update on our COVID-19. Welcome back, and I hope that those numbers have informed you and not created some sort of panic, but also to allow you the reality of what's happening here in South Africa. Let's now continue with our fertility show, and very importantly, we have our weekly wellness bumper, so have a weekly wellness segment, so have a look at this. We now welcome our wellness coach, transformational coach rather, Shia Stithalkin, and absolute pleasure chatting to her on this topic of fertility. Now, she has an immense passion for people and a holistic approach in healing, and that's also what we're going to be focusing on. And at the end of the day, this, as I mentioned, this isn't a topic that often we speak about. So let's dig into that as well. Assalamu alaikum to you, Shahista, and welcome to ITV.
Wa alaikum salam wa rahmatullahi wa barakatuh. Jazakallah so much for having me.
Only a pleasure. Thanks for making time. Let's talk about understanding the stigma attached to infertility and how it affects the couple.
So infertility affects millions of people, and it does not discriminate. So as you know, be it gender, religions, races, the cause of infertility is equally shared by men as well as women. And what researchers have found that it's contributed to lifestyle or hormonal or metabolic situations, but the stigma still exists in society. And this is mostly because fertility is seen as something to be respected. And when you are infertile, it is often like a labeling of shame for the female, especially in the relationship, for not being able to conceive or have a child. And you would think this is the 21st century, but infertility is still discriminated against, and the couple goes through a lot of pressure. I'm sure you have also heard these questions being asked to people. The clock is ticking, so when are you having a baby? And those kind of questions. That's often when the stigma does get attached to infertility, and you also feel ashamed for not being able to conceive a child.
Now, I've noticed that you have a passion for contributing immensely in uplifting communities. And those words that you just mentioned now comes from members of our community, comes from members of our family. How do we help educate them and ourselves to better handle those negative connotations?
I think it comes through education. A lot of the time, back in the day, being unable to conceive used to be seen as a sort of punishment. I think people didn't really understand the factors behind why people can't conceive. And I think it's become really more popular now from the hormonal challenges that a lot of females, as well as men, are facing in our communities, that we educate the people and make them informed about what actually infertility is. That's the first step that I would deal with in tackling the problem. However, you must remember we cannot control other people's behaviors. We can only control our own behavior. And how we respond to them as couples or individuals who are struggling with infertility affects us and our well-being. So the starting point for me as a coach or a counselor dealing with a couple or person coming for assistance is for them to be able to control themselves and their environment and actually teach them tools on how to actually manage situations where they are in discomfort or maybe feeling ashamed or unable to answer these difficult questions.
Talk us through the steps of understanding how we can understand from outsiders how exactly infertility affects or mentally affects, the couple, those individuals that are dealing with it. Shaista, are you with us? Oh, we seem to have some
major life event.
Okay.
Yes, I am.
Okay. You go ahead. There was just some delay.
Can you hear me?
Yeah. Go ahead.
Okay. So it's about social as well as psychological problems. The cognitive reactions include
Okay, I tell you what,
mental
Shaista,
disengagement from social gatherings, low self-esteem.
All right, unfortunately, we will start that question, that segment over again. We'll just had some delay, some technical issues. The World Wide Web is not agreeing with us. We'll connect with Shaista on the topic of fertility just after this. Welcome back. This is Health Matters. Infertility is what we are breaking down for you. And first, we have some mental advice from transformational coach Shaista. You can also hear from her radio show called Inspired Living. Assalamu alaikum and welcome back, Shaista.
Wa alaikum salam. Thank you for having me, Khawla.
Only a pleasure. Let's get down to our next question. And often we don't quite understand what that couple, that individual is going through when it comes to the mental health of dealing with infertility. Just take us through that.
Okay, so infertility is a major life event and it brings about social and psychological problems, not only for the individual, but for the couple as a whole. And these cognitive reactions often lead to low self-esteem, low self-worth, feelings of failure, feelings of where you are feeling guilty or shame for being unable to do the natural thing of conception. And that's how it is perceived, as we spoke about the stigma earlier. And it has a profound impact on the mental health of the patient, physically, emotionally, spiritually, and financially. These are all aspects of life that are being affected through this reproductive system, which is now a disease of infertility. And we have the stereotypical role in which we are living in communities and there's certain expectations placed on us. So with our mental health, I think the most common effects would be anxiety and depression. And these are intrusive because they need to be seen to medically as well. They become feelings of stress and anger, a lot of fear-based feelings as well, sadness. And with each, what we find is when you hear of a friend that's falling pregnant, or you see another pregnant woman as a female, these are the feelings that we internalize and become these emotions that overtake our mental state. And as a father in a couple with infertility, you also have certain feelings of guilt and depression because you are unable to fulfill that duty and that role, being a parent. So yes, of course, the mental health is one of the first places that would be affected after your emotional health.
Let's look at the tools that one can use to deal with that anxiety and depression and that mental instability, perhaps.
So let me just say up front that anxiety disorder and depression have to be diagnosed by a healthcare professional, because often we misunderstand our feelings. We get a sense of panic and fear, and then we want to self-diagnose it and give it a title, you know. So fertility counseling has become a specialized place in the broad framework of psychotherapy. And with coaches and counselors, we are required to develop the knowledge of the vast range of the medical components as well as the third-party processes. So it's not really something that you can immediately get into as a coach or counselor. And parenthood being one of these major transitions in adult life for both men and women, the stress of fulfilling that role is greatly emphasized and associated with those feelings. So the tools therefrom would be, I've actually narrowed it down to 5 basic tools. And the cognitive behavioral therapy addresses the couple or the relationship with reframing. Then we have the training in coping skills. You know, often we don't know how to ourselves be able to handle situations. The third would be something that I use often, and it's communication building skills. And what I find is, especially with a period of time where we are going through a problem as a couple, we often lose communication or we miscommunicate. The third would be techniques for relaxation response, because our first response is often fight or fright, you know. And when we respond with a relaxation, what we do is we process the information better. So these are things that can be taught to you. And the last would be something very practical, which I really have a lot of respect for, and it's support groups. It can be in the form of WhatsApp or social media. And what I find from them is people can empathize with you, because often we're dealing with infertile couples and infertile females. What I find is that sense of defensiveness, because you can't often relate to them. They want to talk to people who've been through this. And some of the tools are as basic as just having the conversation, exposing yourself to like-minded situations, like-minded couples going through the same situation. And that can provide a lot of comfort.
Shaista, we want these individuals to live fulfilling lives. And as you explained, centering and being at peace, peace at mind, and seeking the necessary, mental health helps with all of that. So how, can couples or individuals live an emotionally fulfilling life and still deal with infertility?
So remember, infertility may be the very first medical crisis that a couple may go through together. And in their relationship, as a coach, we usually guide them to the sense of actual grief and loss, because it's a part of them. It's formed as a part of their identity growing up sometimes. And couples that experience it have a very diminished sense of union. And what happens is, going forward, it is common for them to socially isolate themselves from interacting with other couples. And we find that these type of adjustments to their environment become difficult. So what I do suggest is, when females do have this new perception of what their life should be post infertility, is letting go of the old ideas of what your life should be. Those dictated terms or those social conditioning moments that we actually grew up believing and thinking our life should take the path of and the journey should be. The second would be changing one's outlook and understanding where their happiness lies. Often we link our happiness to certain moments, a job promotion, getting pregnant, but also getting married, getting the approval of someone. So understanding that your happiness has to start with you, I would suggest, is a very good indicator of living that fulfilled life. The third would be choosing how to spend your time, because our time is often managed by our priorities. And sometimes exposing ourselves to certain situations that are uncomfortable, but managing the amount of exposure that we have gives us this idea that in order to live a full life, we need to choose where we focus our attention and where we actually get affected most. So in situations, is it harming you or is it helping you? And then lastly, I think to make the conscious decision that you will leave a legacy, and it does not have to be through a lineage. I think finding a purpose and living and seeking through that purpose of how to actually live your life, conduct yourself, is far more important in leaving a legacy. I mean, if anything, we've learned that people remember how you made them feel. They remember what you've said to them. They remember situations of kindness. And it's not necessarily people from family and friends that will pray for you when you pass on. So it's the little things in life, those strangers that you encounter, that charity work that you do, just exerting yourself to find a new meaning for this legacy. I think it is quite traumatic to accept that you are going through infertility, but there is a way out, and there is a way where we can navigate through life being content and finding contentment with the Creator's decision. Ultimately, if we submit and we understand that it is out of our control, I think that's when the greatest understanding of the life and the fulfillment of the life would come from.
It's such a beautiful explanation on the way forward for many challenges. But at the end of the day, society, those loved ones, those closest to us, can say the most horrible things without even realizing it. You mentioned a few of them earlier, like the clock is ticking, when are you going to start a family? And without even realizing it, you might be damaging that person's, current situation that they're going through. So what can we as individuals, members of family, a community, knowing that that couple is going through a difficult situation, not say to them when they're actually needing time to heal and deal with the infertility issue?
Look, if there's anything your listeners do take from this conversation, is that if we as individuals introspect, and if we start with looking out at ourselves and our challenges and our successes and our failures, it is only then that we realize that we are in a situation for self-improvement, and therefore we should be less harsh to others around us. And often it is a projection of our emotions when we attack or defend or speak to other people. And what I find is with family members, if we guide them into our situations and not try to keep it secret, because again, that secrecy, that stereotyping is a stigma. So communicating with them about the situation or the fact that you may choose not to have a child. Remember, a lot of infertility may also be a personal choice of not having a child yet. And I think just being able to talk to people openly and realize that you're not a victim in the situation, but this has been written for you and it's your challenge and your test, and how you go forward with that strength, but also with that encouragement for the next person. I think it sets a tone for a great learning moment and teaching moment for others. So I think, yes, a lot of introspection, and possibly in a very nice way, asking people to respect your privacy even.
And that's actually my next question, privacy. Some people feel the need to talk about it because it helps them. And then you are exposed to others' opinions, others' addiction, opinions about infertility and how you should be handling it. So you have to be, I think, in a certain mental capacity to be able to understand that. So let's talk about that privacy. If you have decided to not, mention it to anybody, maybe just your closest, your parents, not even your siblings or further than that, but the word gets out. And all of a sudden your world is turned around and you have to now handle the rest of the world, which is your closest knit family that knows this about you. And that can be quite traumatic for the couple or the individuals. Let's talk about dealing with privacy and when it's not, when it isn't private anymore and it then becomes public.
Remember, I think marriage just by itself is a major challenge for us all because of the firstly adjusting to another person in our personal space, and then also the personality adjustment. But then when you throw something like infertility into a mix, it gives a far more bigger sense of challenge in a marriage as a relationship. So the starting point with the privacy is to make sure that the couple are on the same page. Because when you have the support of a spouse and the communication that is open as to a way forward or how to answer these difficult questions, how much should we say, how little do we say, and so forth, I think that already gives you a sense that you are not alone. Remember, a situation like infertility should be shared by the couple and not just internalized by the female because she is the carrier of the pregnancy or the child. I think when we do get that right as a couple, as people that are sharing this natural problem, such as infertility, I think that's where we can then face the outside world because our internal and immediate environment gets fixed. And I think often we are aware and we are very conscious when we decide to speak to people and share things. And when we do that, we understand the repercussions of it. And we shouldn't use infertility as anything different. It is a conversation to be had. And if you do want to remain private about it, then you should be strong enough to understand that the questions may be asked and it is you that is politely declining to share and open it up. But I think we shouldn't water down the idea that people will change. As I mentioned earlier, we should be accepting to the fact that we do live in community. We live amongst our families and our friends. And sometimes out of care, people would ask, and sometimes out of curiosity. But that's just human nature, isn't it?
Absolutely. Wise words from Shahista Thokan, our transformational coach, and we can see now why you've been in education and educating people about their mental wellness for over a decade. We appreciate your time and effort. Please do catch her on her radio show Inspired Living and on Instagram and various social pages. Shahista, our transformational coach, chatting to us about infertility. Shukran and assalamu alaikum to you. Have a good day further, Shahista.
Wa alaikum salam. Jazakallah for having me.
Khair. We'll continue with this topic. Very important. Sit down and let's take a listen. If it doesn't affect you, let's keep that conversation going about it to others. So the education is surrounded around fertility. More just after this. Assalamu alaikum wa rahmatullahi wa barakatuh. Very good day and thank you for joining us. We are broadcasting at the beautiful Fertility Africa show for the first within South Africa and Africa. Today we will be speaking to Dr. Yusuf Dasu, who is a fertility specialist from, also the founder of BioArt Fertility Center. And he had a talk today about endometriosis, and he's going to be chatting a little bit more intensely about the subject itself. But let's find out. Assalamu alaikum to you, Doc.
Wa alaikum salam. Thank you for having me.
It's a pleasure. So tell us a bit, firstly, I want to know, what is your thoughts, your emotions, your feelings around the first fertility show in Africa?
So this is a first for us. We were invited to participate in this show, and I think it's about time that a show like this was brought forth to the public, just to bring awareness of the problem of infertility. As we know in the medical field that infertility is a huge problem, and now to go out and have an expo and expose and get educational material about it, get more knowledge about the different specialities that offer fertility treatment, I think it's wonderful for South Africa and certainly for Africa on the whole.
Absolutely. So, alhamdulillah, I was here yesterday and today being a more sort of public day, there's a lot more response. What did you think about the response today?
Yeah, I think today's response seems to be much, much better. It's probably because it's a weekend as well, and people are now coming in, and wonderful. We'd like to meet as many people as possible.
And the interest in fertility, is it only people that are within those, that has a concern with regards to fertility that are attending?
I think so. I think it is a specialized expo. It's not going to be for people that have many children or don't have problems with fertility, but it's a huge problem. So we'll find that despite it being a smaller segment of our community, it arouses a lot of interest, and therefore it's quite nice to have such a show.
Right. So today you spoke about endometriosis. We've heard this word thrown around in conversations with ladies, whether they talk about it or not. What were some of the highlights that you found with regards to responses of what people should actually sort of focus on when it does come to endometriosis?
So today I had to give a talk on endometriosis, and I was trying to highlight the importance of early diagnosis. We often find that a normal young girl will start experiencing some period pains and think it's the norm. They ask their mom, I've got a bit of pain, I need some tablets, and then you go to a doctor and he treats you with some tablets, and then it gets prolonged, and you just accept it. So that's one of the problems. It's a delay in diagnosis, and then by the time you actually realize that you may have a problem falling pregnant because of the endometriosis, you're now over the age of 35. And then it becomes a little bit more difficult. So we're just trying to highlight the importance of this condition, the early diagnosis, and of course to also give hope to couples that, there are treatments available, there's help available. So that's what we're trying to do at a forum. Sorry, at a forum like this.
And often there's a stigma around every condition, this being one that, because you can't fall pregnant, you unfortunately, one of the reasons why endometriosis. So is it something that people have to live with and understand that they can not have children when it comes to this condition? Yeah,
so, it is a chronic condition. It's often a difficult condition to treat. You often can't treat everybody totally. They'll have a high rate of recurrence. But there is hope out there. It's not that you cannot have children. You probably will have difficulty in falling pregnant, but you can have children. With the correct help, you will, inshallah, be able to have a child.
So let's look at living with this condition. What is sort of the understanding of, of the condition that patients should know when they are living with the condition, and sort of the reality of it being a lifelong condition that they have to live with? What helps them understand it and actually become better at this condition, like, helping it actually make you fall pregnant, sort of reading or, talking to people about it, because then you often feel isolated if you're the only one that has this.
Yeah, so the first thing is education. I think if a patient or a couple, because when you have an infertility problem, it's a couple involved, you have to first find out, is that the only problem? Are there any other issues? Are there any male factors? What's your age? In terms of, if you're young, you have time on your side, so you can wait and see if you can conceive. Yes, endometriosis affects fertility, but you can fall pregnant. It may take you a bit longer to fall pregnant naturally. You may require surgery, and if you have surgery, post-surgery, you improve your chances of falling pregnant. But what we need to highlight is that don't delay. If you're over the age of 35, and there are tests available to check your ovarian reserve. If you've got a good ovarian reserve, you've got time. If you don't have a good ovarian reserve, then you have to be more active and quicker in terms of different treatment modalities that are available.
All right, so when you say different treatment modalities, we know that, alhamdulillah, alternate healing has actually helped in this industry. We see them here, displayed at the show, and there must be a place for it. So let us understand how the brain and the body needs to work when it comes to endometriosis.
So, medical science is not the answer to everything. And that's why we always need parallel support. And that's where alternative healing also helps. Good eating habits, good lifestyle changes, all those exercising, releasing natural endorphins to try and manage your pain, all those are very, very important. So yes, we need to complement both type of medicine. There's a place for everything.
Addition to seeing a medical doctor, what about support at home, communities, outside world? Does that also help with sort of living with endometriosis?
Yes, speaking about the condition, I know there was a society called the Endometriosis Society of South Africa. I'm not sure how functional it is, but there's a lot of patients that come to me. They engage in social media. They have groups, support groups, and they all find that to be very, very helpful because they can understand that other patients are going through the same problem. They're also experiencing the pain. They also have problems with fertility. They also have problems with recurrence of the disease. And if you know you're not the only person, you then feel that there is some support out there. And I think in that way, it gives you some better relief to be able to cope with this condition.
Your final words on endometriosis, and hopefully, inshallah, we'll have a more in-depth program on ITV Health Matters. But and also being here at the function at this fertility show of Africa. Your last words, sir.
So the important thing is that I would like to stress the importance of early diagnosis. There's treatment available. Never fear. Inshallah, there is always cure.
Great stuff. Shukran. Jazakallah so much to you, Dr. Yusuf. We appreciate your time and all the best with the show. There you have it. That was Dr. Yusuf Dasu, and he's a fertility specialist and founder of Bio Art and the Fertility Center. From myself, Khawa Solomon, I'll chat to you again. Welcome back to Fertility Show Africa. We have our registered homeopathic practitioner with us, and she's joined at the show. Thank you so much for being here.
Thank you so much for interviewing me.
So Dr. Bianca De Kanya, homeopath, this is something I can go on and on about, so I love it. Of course, there are some viewers out there that is not too affair with homeopath. Tell us quickly how it works and what role it does play in fertility.
So homeopathy is a complementary medicine. We by no means try and take the role of our fertility specialist. However, our role is really about looking at the person as an individual. Each individual experiences their symptoms very differently. Two people with painful periods would experience it very differently. So the role of the homeopath is really to help that body to then achieve that normal balance so that our fertility specialists then have a healthier individual to then work with.
Okay, so you work with the specialist?
Well, at my practice, what we do is our ultimate goal is for our patients to fall pregnant naturally. However, we have to be very realistic about timelines and the fact that this really is a very sensitive topic. So what we do is that if after a particular short amount of time, if after the body is working appropriately and we don't get the results that we want, I then refer on just so that we can, work hand in hand with our medical brothers who can then facilitate in the IVF process the assisted techniques. But we're very realistic about it as well.
Okay, you spoke about timeline, and for me, many people are sort of not to, let's go with homeopath because it's because of the timeline. I want a quick fix. I want this to happen now. So let's just unpack that. What is the timeline when it comes to homeopathy?
How long is a piece of string? It's difficult to say. You might have one individual who has one or two minor health issues, and that's fairly quick to rectify. You might have someone else who's dealing with a myriad. There may be underactive thyroid. You could have blood sugar issues. You could have irregularities, amenorrhea. So it really does depend on the person, and fundamentally, always remembering that it's as long as a piece of string. So each person has that individual approach, but then also there's that protocol which is designed specific for each patient.
Okay. So let's quickly understand homeopathy and how this actually does work well with fertility.
So essentially fertility or good fertility, or the fact that people can fall pregnant easily, shows that the body is in harmony and working well. So anytime we have a deviation from that, we then know that there is a disharmony or an issue somewhere. So homeopathy is really about bringing that body back into alignment and helping it to work better. In the instance where we have structural issues, where tubes may be missing, ovaries non-functional, getting the system to work better as a whole, not just in terms of their hormones, but how their digestive system works, how they are exercising, how their sleep is very important. So even in situations where we are not going to achieve natural fertility, ultimately getting good health is going to be a great place to start for fertility treatment going ahead.
So why choose homeopathy in the aspect of fertility?
It's about healthcare, not sick care. So we don't wait to get sick to then go and look for the problem. We should really change our minds and our thinking to let me get healthy first before I fall pregnant. What I've sort of realized while being in practice is that sometimes people think I will get pregnant and then I will, get healthy. But it doesn't work that way. You've really got to look after your health to begin with so that we can fall pregnant and have a healthy pregnancy and healthy baby.
Does homeopathy work together with anything else, like your support system, socially? Talk to us about that connection.
So I have a lovely team of practitioners that I work with. I have a dietitian, I have a chiropractor, a psychologist, and a biokineticist. So we really look after the mind, the body, and of course your emotions as well. So we fundamentally work together with people. I think that that's the way that healthcare should be. There's no one fix all or one doctor that can do it all, and that there are many aspects to people. People are not just one dimensional. There's many facets to them, and perhaps they don't need the homeopath. Perhaps what they need is the dietitian, or perhaps what they need is the psychologist. They can just release that a bit of stress, and lo and behold, you go back to your normal cycles.
So Dr. Bianca, where are you based and how can people get hold of you?
So I'm in Krugersdorp at the Pure Health Centre. People can contact me. They can either go to our website, which is www.purehealthcentre.co.za. We also have a Facebook page that we're quite active on, sharing information, interesting articles, advice, guidance, and really just uplifting our community. They can also contact us on 011 954 6091 or 6981 if you wanted more information or an appointment.
Thank you so much, Dr. Bianca.
Thank you. Thank you so much for your time. I appreciate it. Thank you.
Welcome back. Assalamu alaikum. Good day. This is ITV Networks live from the Fertility Show Africa here in Gallagher Convention Centre in Johannesburg. I'm Khawa Solomon, and today we speak to Dr. Olufemi Olaragan, and he is a reproductive medicine practicing in Cape Town, also fertility specialist, and he tells us a little bit more about the work that they do at Groote Schuur Hospital. Very good day to you, sir. Thank you so much for joining us.
Thank you very much for having me. It's good to be here.
It's a pleasure. First of its kind fertility show, Africa, South Africa. What do you think? Your thoughts, the visitors?
It's been good. I mean, I've liked the turnout, the different fertility clinics have been here, the people. What I've enjoyed particularly is people walking up to you from the streets who've heard about the show and come to talk to you about their issues and how they can get treatment. I think it's fantastic. I think it could grow. I think in the next couple of years we should have a much bigger one. Because fertility, as you know, is a factor, and people should know. The more they know about it, the better it is for everyone.
So maybe next year it will move to Cape Town, and you'll see them.
It would be lovely to have it in Cape Town, I'm sure. And I'm sure the turnout will be just as good, probably even better in Cape Town, hopefully.
Absolutely. So let's talk about the work that you do. You are at the Heart Clinic, the Heart Fertility Clinic and IVF Clinic at Groote Schuur. Let's talk about the work that you do there.
So, at Groote Schuur, I work in the reproductive medicine unit of Groote Schuur, which is the unit that deals with people trying to conceive and have fertility issues. I head one of the firms there in conjunction with a few other consultants. And the work we do there is do surgical work in terms of patients who have endometriosis or fibroids or PID that need surgery to correct those abnormalities. If they do need IVF, Groote Schuur is one of the units that offer public IVF, which is quite rare. I think we only have 2 units in the whole of the country that does public IVF. So Groote Schuur is one of those. And these patients, if they belong to where they live in a certain area and they belong to a certain criteria that we use, they can qualify to have IVF done at Groote Schuur, yeah.
Let's talk about the public sector. I mean, most of the participants here, exhibitors, are within private. You being involved one-on-one, how accessible? Are there any challenges when it does come to? And I'm sure it's a A plus. Firstly, that the centre is there.
Absolutely. So, like I said earlier, there are only 2 units that is public, and as you can see, I mean, the problem is that it's so expensive. So that's what it comes down to. Private IVF is probably about 65,000, maybe 70, in some places even more. In the public service, definitely in Cape Town, you could probably get away with about 20 or 25,000 for a cycle. So it's still expensive, but not as bad as in the private. So the fact that it's there is a big plus. The downside of it is that because it's government subsidized, it can be offered freely to everyone, unfortunately. So in the recent years, people who have IVF in Kruchiski have to fit a certain criteria and live in a certain area. So it's not open to everyone, but at least it caters for a certain sector of the society. And then there are sort of things like if you have 3 or 4 other kids from a previous relationship, you can come in there. If your weight is beyond a certain level, so they have to have criteria just to make it more cost effective for what we do. So it's a big plus that it's there, but it's not available to everybody. So that's the big challenge, is the fact that it will be good to make it cheaper than what it is, and to make it freely available to everyone that can walk through the door and have public IVF. But unfortunately, there's actually probably very few places in the world where that's the case. So even in the UK, where the NHI sometimes offers a little bit of IVF in the public sector, it's not always for everyone. There's criteria, age, where you live, all that. So they all have to do that because it's just not affordable to have it available for everyone.
So everybody that's watching, because I mean we've got viewers from South Africa and Africa and a little bit abroad, let's talk about the criteria and what people can look at, because sometimes they think there is no hope for them, and there might be somebody out there that, you know what, I happen to fall in that category. Tell us some of it.
Sure. So the criteria that most public hospitals use for IVF will be weight. So if you have a BMI of over 35, for instance, your chances with IVF is lower. So they would rather offer it to somebody who does not have that issue. So, and it's something you can change. So if the patient has a BMI over 33, I think is the cutoff now, you're advised to go and lose weight and come back. If you have between the two couples, if they have, say, 2 kids from a previous relationship on the one hand, and maybe another 2 or 3 kids from the guy on the other hand, like you got 5 kids in union, we should not be offering you this kind of service. And then age becomes a factor as well. Above the age of 42, your chances of success at IVF is so low that you don't want to put your resources into that. So you have to have an age cutoff as well. But generally, every other thing fits in. So if you don't have those issues, for instance, you've got 3 previous cesarean sections, it might be thought that you should not be having another Caesar, so you shouldn't have another child because it's too dangerous. So there are little factors like that, mostly medical. But what I would suggest is do the research. If you think that you might be able to just phone them up, look them up, send them an email, and they could tell you if you qualify or not.
And what about males, the partner involved in the IVS? What role do they have to play?
A big role, obviously, because they half the role. But what we do as far as the males are concerned is, again, make sure that they don't have like 5 or 6 other children somewhere else. That's the one factor. The other issue will be to make sure that they're not people that are extremely heavy smokers or that drink heavily or use drugs and stuff. You want to be sure about that. And then you want to make sure that semen is fine. Make sure the semen is normal.
Okay. Yeah. So let's quickly wrap this up and understand the way forward for people that do have to approach the public sector. It's available in Cape Town. Is there any sort of statutory with regards to being in Cape Town?
Yeah, I think you have to live in Cape Town, and you have to live in the area of the Kruchiski Hospital, so the drainage area for Kruchiski Hospital. If you live, there's another one in Tigerberg, by the way. So if you live in the northern suburbs, you can, for that. Again, they have their own criteria as well. So depending on where you fall into, you can get services from one of those places. If you come from outside Cape Town, I'm afraid they won't be able to offer you a service.
Let's talk about the duration of this. How long is it? Because falling pregnant is already such a draining and lengthy, and miscarrying or losing or not being able to. What is the IVF period?
So it's not a lot, really. I mean, most of the cycles that we use now is tailored down to about 2 or 3 weeks of treatment in total. So often the preparation might take longer, or once the procedure starts, once the process starts, usually completed within 2 or 3 weeks.
Great stuff. We need to wrap up. Dr. Lefemi, any last words with regards to the work that you do, the patients that you see, and just being here at the Fertility Africa show?
It's been very fantastic. Thanks for having me on this program. All I'll say to people out there is that help is available. Look for it.
Great stuff. Thank you so much to Dr. Elefemi Olagaram, and he's in reproductive medicine at Groote Heart IVF Clinic. So please make contact with them if you fall within that demographics. And as he said, help is out there. And we're here at one of the exhibitors for Fertility Show Africa, Hormonal Harmony. They did a talk which we'll showcase with you, to you rather, a little bit later on. We have Beatrice and Rona, and they actually try to optimize the natural conception within that fertility period, fertility awareness method. So just like, you know, everything's happening around you, so now's the perfect time, now's the, you know, the target moment, you are fertile, you're ovulating, all of those things, but also what leads up to that. So they look at your lifestyle, what you are eating, and all of that. So we have Beatrice and Rona here with us. Beatrice is a fertility awareness educator. She's also a retailer for the cloth pads. Yes? Rona. The menstrual pads, as well as the menstrual cup. And I know you've got a long list of what you still do as well, but fertility awareness is sort of educator, is sort of the target for that. And Beatrice Rapkin is a nutritional therapist and reproductive health educator as well. So quickly, guys, if I could start with Beatrice quickly, you know, so it leads up to that moment of now's the time, let's do this. So we're not going to get into that, but we're going to get into the nitty-gritties of leading up to that, the lifestyle and the diet. What is most important that we need to focus on?
I would think that the most important thing, first of all, you want to make your uterus a safe place to grow a baby. And in other words, you have to do whatever you can to tell your body, tell your brain that it's a safe place. And by giving your body as much nutrients, nutritious food as you possibly can, that is, as far as I'm concerned, key. Yeah. It doesn't matter what type of conception you want, whether it's IVF or IUI or natural. If you do not have a healthy egg and a healthy sperm, which comes from eating properly, then you might as well.
Tell us, what is that? What is eating properly? Does it include organic, lots of greens? Yeah.
Well, I mean, organic wouldn't that be great that if everybody could eat organic? Because obviously, you know, the herbicides, the pesticides, the hormones, the antibiotics that are in our food is stressful for our body. It changes the microbiome. It changes everything so much, and it puts stress on your immune system. There's also, if you also want to eat as much vegetables as you possibly can. So, I mean, I would think, as I suggest, something in the region of 70 to 80% of your diet being vegetables, and, you know, 1 or 2 fruits. But that's, I mean, obviously that changes per person, because both people with diabetic or polycystic ovary syndrome, then that's an issue. And then you want to eat fruits and vegetables that are very nutrient dense. That's ones that are highly colored. You want a wide variety. You want between 40 and 50 different whole foods a week.
Sure. What about meat and poultry and dairy?
So, I mean, dairy is a really hot topic. A lot of people have dairy intolerances, and if you are going to eat dairy, it preferably unpasteurized, which is almost impossible, and also organic, because animals, whatever they're eating, they will hide their toxins in their fat. So, and that's that's where you get dairy from. But in terms of actual animal products like meat and chicken and fish and eggs, you also want to try and find the best possible source that you can get, because again, infused with herbicides, pesticides, and potentially could be fed with genetically modified corn, which is what most, when you see that grain fed, that's what it is.
Okay.
Genetically modified grain, corn.
Okay, Beatrice, thank you for that. So, our educator, we have a fertility awareness educator. I know you've got giving this away at your stand. Tell us quickly, what is optimal for fertility when it comes to understanding of how things work?
Well, fertility awareness method is all about cervical fluid, is about basal body temperature, and about cervix position. So for me, as a fertility awareness educator, I want to see a good quality of cervical fluid, like 5 to 7 days that you have this cervical fluid. We want to see that after that you ovulate, and we can see that in the charts. It's very easy to see once you take your basal body temperature. We want to see that the progesterone phase is quite between 12 to 16 days, high temperatures, that they're not hovering or not fluctuating down. So if I have to look at the chart, I want to see that your cervical fluid is good quality, stretchy, egg whites, it changes throughout your fertile wave. We want to see that you've ovulated. We want to see that there is a long, nice phase of your progesterone, of your high temperature. That would be great. And if not, obviously we can look into nutrition and things to improve that, because that can be improved naturally.
Yes. Wow, that was a mouthful. So quickly, ladies, tell us where we can find you, because apparently you're only in Cape Town. If anybody want to get hold of you,
We are doing courses online and consultations online as well. I'm fertilityaware.co.za or Mindful Menstrual Cycles on Facebook or WhatsApp or whatever from lots of social media. They can find me there my email is nurturing@ronamarimi.co.za.
great stuff. Thank you so much, ladies. Rona and Beatrice are our hormonal harmony.
And you can find us also on Facebook, or we have a website, hormonalharmony.co.za. And we also on Instagram.
Great stuff,
And you should
ladies.
follow my daughter on Instagram. She's great.
Thank you. Is she Nicola? Okay. Thank you so much for you.
She's 15 weeks pregnant, and she got pregnant first time using fertility awareness method.
Oh, brilliant. There we go. So be aware of your fertility and your hormones so they can hormonally be in harmony. Thank you so much, ladies.
Thank you.